So we are talking about neck and back pain, and I hope you get some pointers, but I must preface it by saying you won't walk out of here with any less pain necessarily if you had any coming in. But you can definitely have more tools under your belt so you can work at it. So today's take-home message, I really hope you'll identify those common risk factors that are involved in the development in pain, both in the neck and the back, so that you can take a little more proactive approach and do more self-management strategies to take care of your issues, maybe even preventing you from needing future medical care or further ongoing care. I am a therapist and I love to treat people. However, when I finish treating people, I usually tell them, I'd love to see you at Walmart or Hy-Vee or at the mall here at Lyndale, not back in my clinic with further pain. So I hope today, again, you'll take away some good strategies that you can use to reduce the risk of developing it or to reduce the impact of pain that you may already have. Let's take a look. So really, why are we here talking about back pain? I think it's pretty evidenced by the number of folks here coming to listen to the talk, that it's out there and it's common and it's pretty impairing. When we talk about pain, we talk about not only the physical issue of pain, but we have to talk about how that strains some of our mental health issues, some of our relationships with other people, and certainly can affect our job and our ability to do our activities in our home. So low back pain specifically is the second most common reason for visits to primary care physicians. When we talk about primary care physician visits, we talk about our out-of-pocket copay, we talk about the costs for interventions of medications that we may be starting or further treatments, and that definitely adds up to the economic side of things. Down at the bottom there that states that $86 billion a year is spent just by Americans for care for our back pain, which is up 65% just from the last decade. So 10 years ago, we were spending over less than half, if that makes any sense, than what we spend today. So costs are up. People are definitely affected in their daily lives. In fact, 4 out of 5 people in the U.S. will experience low back pain at some point. Now, is that going to necessarily be the type that affects you and knocks you out of work or knocks you out of your everyday activities for a long period of time? Not necessarily, because the stats are good that the natural course for low back pain, an average first-time incidence, is that within 6 weeks, pain does resolve on its own if you continue your regular activities. So most of the back pain that's out there, we can get to go away with time, with TLC, with some ice, things like that. When it comes to the ongoing pain that lasts longer than the 6 weeks or is impairing other body functions or body activities, that's when the cost can really add up. When we talk about neck pain, it is the third most common type of pain for Americans, and that's a stat released by the National Institute of Health Statistics. About 2/3 of the population will have neck pain within their lifetime. Again, sometimes that's you wake up and you have a stiff neck for a day or two, and other times it impairs you, perhaps leads to some time off work or perhaps needing further care or further treatments. The incidence or the issue with neck pain is generally it's not just good old neck pain. Oftentimes the neck pain can refer pain into the shoulder blade, and even into sort of the middle back area. In addition, the upper neck pain can often trigger headaches. So some folks may say, oh, my neck is great, but I get headaches every day. As a clinician, the first place I'm going to look for that person is their neck to see if there's any strong relationship there, because oftentimes there can be. So oftentimes people come to me and they say, well, what is my problem? What is causing my pain? Is it my bone? Is it my disc? Is it my ligaments? Oftentimes they'll get a diagnosis maybe of degenerative disc disease, and they'll say, is this the cause of my pain? And I say, I'm not sure. You know, looking at a person is very difficult to tell what their pain generator is. They may also have some other issues in their spine that may occur with normal aging, like some wear and tear. But it's difficult to identify a certain structure, like the muscles or the soft tissues, that can be the exact source of your pain. Certainly, when I'm evaluating an individual with pain, I don't have x-ray eyes, and I can't, see them to see which exact structure is involved. But actually, I've learned through the years, I don't think I would use my x-ray vision if I were gifted with it. While it's tempting to believe that imaging studies, like CT, x-rays, and MRIs, can pinpoint with a neon flashing arrow where your area of pain is coming from, these scans typically are not even indicated in folks to be used until that normal, natural course of the pain subsides, maybe after 6 weeks, 6 to 8 weeks. So we can't always hang our hats on these tests to point to the violating tissue, because some studies show us that groups of people who don't report any pain may have some similar scans. In other words, there are studies out there that show a group of individuals with reported pain take MRIs, and there are certain findings. They take a separate group of individuals with no pain reported, take MRIs, and oftentimes it's difficult, if the examiners don't know which group they came from, to tell which patient is which. So there are some normal deviations in our spines, in the tissue, as well as there's some normal age-related changes that can occur, or traumatic changes that may not cause pain in individuals. So it is tempting to want to get a picture of the inside of your body where you're painful. But again, I caution you that I really would rather look towards how we can find certain positions, postures, or activities for you folks to do to improve your pain, rather than to be focused on the cause or the reason of your pain. So let's look at risk factors. Number one risk factor out there, whether it's neck or back pain that you're having, is that you've had a previous episode of neck or back pain. In fact, about 85% of people with one episode of back or neck pain will be susceptible to a future episode. May be not as long as the first episode, it may be longer. It may involve a different area as well, so it won't exactly look like the first. But again, studies out there show once we have one episode, we're set up for continued issues with it. When we look at heavy lifting or awkward work or living positions, those I like to think about mechanics with their head inside the hood of a car all day, craning their necks forward, can develop some neck issues. Those heavy lifters, in factories, stacking pallets, those can be difficult. But what we overlook sometimes is the kindergarten teacher, who certainly is not lifting, certainly is not craning her neck. However, she is stooping forward at a slight degree for long periods of time throughout the day to work with her children. We look at poor prolonged positioning. So the desk worker saying, I can't believe I have back pain. I just sit all day. How can I possibly develop back pain? What we find is the spine loves to move. And when we lock that spine in a certain position, and in a position of kind of a stretching manner for long periods of time, that develops wear and tear and can certainly lead to breakdown in certain areas, which can cause pain. The other risk factors, which are not as directly related but definitely can affect pain that you have, would be smoking, obesity, and decline in physical fitness. If you think about the health of our tissues, with smoking, nicotine restricts that flow of oxygen to our tissues, which can kind of degrade the normal health of the tissue. With obesity, our tissues are carrying such a stronger load than they would be otherwise. And with the decline in physical fitness, again, our tissues lose that natural tensile strength and elasticity that helps make them strong and resistant to injury. So what are some standard treatments out there? There's a lot. And there really is no algorithm or cookie cutter approach to someone that has pain, because again, it could be various tissues or structures involved that may be your cause of pain that is very different from someone else's cause of pain. The good thing again is that the new onset pain, or the brand new stuff that you wake up with or get after a car accident, the odds are with you that that natural resolution of your pain will be within 6 weeks. And that the recommendation is continue everyday activity within your tolerance. But if that is going slower than anticipated or having further complications, certainly there are medications like anti-inflammatories, pain medicine, muscle relaxants that are kind of first line of defense for our primary doctors to use to speed along that natural course of recovery. Physical therapy, yay, is another treatment that I like to think it works pretty well a lot of the time, because we look at restoring those joints to normal movement, getting the person more active, and we try to focus on what you've lost in their activity and how to help you gain that back. Chiropractic manipulation, again, has some good research as far as pain relief. Acupuncture and massage are good adjunct type treatments if you're looking for pain relief as well. I mentioned behavioral health services, again, because pain not only affects the physical body, but it can certainly wear on the mental and the spiritual body. So sometimes we look at how pain affects your mood, how pain affects your interaction with others, your relationships, your coworker interactions. And so sometimes to work through some of these pain issues, we may recommend, that you are seeing or be consulted by someone in the behavioral health services areas. Certainly injections and other procedures that clinics like the pain clinic can provide for you, interventional pain clinic, which we do have in our spine center at Mercy, as well as surgery. Again, I tend to list medications first and surgery last, but there really is no set course. And it depends on, what your certain situation is, how much pain you're having, and the course that your doctor would like you to kind of follow through. Again, to the next slide, bed rest. Sounds really good. Be great if I hurt to just lay down for a couple of days. But unfortunately, they find these days that there really is no good research to back that up. Again, we love to move our joints. They desire you to move them. And that's why, the Steps to Health program is great, because it can get us moving again. So everyday activities are encouraged to keep those joints mobile during the inflammatory phase. And that's that first phase where kind of like a brand new ankle injury. Everything's hot, swollen, every movement bothers you. It's best to keep moving through your normal everyday activities, so the research says. That doesn't mean push yourself. So if you do a job that's a physical, work, or whether it's a home activity, I gotta get those toilets scrubbed out today, that might not be the best day for you to do it a day after a new injury. So carrying on with your normal movements, good. Pushing yourself a little too far too fast, or pushing into pain, is not recommended. Bracing, we talk about, because a lot of times people have pain and they say, oh, if you could just lock me in a brace, I would feel so much better. And while you probably would, for the time being, to help stabilize those joints as they go through their healing process, we really don't recommend bracing for long term either, because of the propensity to develop joint stiffness. And we've already said our joints really want to move. So we wouldn't want to lock that in there, and we wouldn't want to lose any current muscle strength that you have as you're trying to get through your pain episode. So what can we do for our spine? We'll talk about a few things. First, we'll speak about neutral spine postures, then we'll talk about spinal stability, and then keeping your spine flexible, and then how to care for it in a new episode of pain, or when you have maybe a flare-up of an issue that you have already had. So when we speak to neutral spine posture, I'll be inviting our therapy tech, Sarah, up on stage with us to do some demonstrating, and we'll be having you meet Sally Spine as well. So I'm going to grab Sally Spine and we'll talk about neutral spine. Okay. So here she is in all her glory, and you notice she's not a stick straight up and down. And on your handout there, you can see the next slide, there's definite curves that are naturally built into our spine. It makes us a little stronger this way, and it actually relieves some of the pressure along the bone disc interface. It is the natural resting position to be an inward curve through your low back, outward through your middle back, and inward again through your neck. And I liken it to a car that runs with good alignment. You probably rarely have to go in for a tune-up. You probably don't feel a lot of shaking when you hit that 55 mark on the highway. But when we have an alignment issue in the car, you may feel some vibration, you may feel the wheel tugging you in a certain direction. And I would liken that to alignment issues in your spine that may make you feel pain, okay? Let's have Sarah come on up and she'll demonstrate some neutral spine positions for us. Thanks, Sarah. Okay, you hold Sally. We'll put her down. So let's turn and show on your back. Sarah may have this t-shirt made just for today. Isn't that great? So if we look at her from the back side, we can't tell where her curves are. We need to look at her from the side. So again, with her low back, we are looking for an inward rounded curve. The middle back, we naturally kind of go flat or a little bit rounded outward because of our ribs and our lungs. And the neck, again, curves back inward. When we spend time in a forward position, so notice her chin is forward, her back excessively rounds, and we lost quite a bit of that inward dip to her low back. That is straining the natural position of the spine. Good. So when your mom said stand up straight, she really knew what she was talking about. We want to keep neutral spine not only when she's standing perfectly still, not only when she's sitting perfectly still, but when she's moving. So if we have Sarah standing here and she needs to wash dishes, oftentimes people say that that's a difficult or pain-producing task for them. Oftentimes what we see is that she's slightly tilting forward to reach the bottom of the sink, which again loses that natural position. May not hurt for 5 or 6 or 7 minutes, but give her a whole slew of dinner dishes for 20 minutes and she may develop pain, okay? Come on back up. So she lost her position by about 20%, but she held it there for a long time and those tissues were overstretched and developed pain. So what we would, I won't go there, but let's get her in the chair next. So sitting is more stress on our spine than standing, even if we're sitting in the perfect posture. It sounds counterintuitive because a lot of us get more pain relief sitting than we do standing. But studies out there show that on our discs, which sit in between our bones, there's more pressure sitting, even in great position, than standing. So we want to maximize how we're sitting so that we can reduce that risk and reduce that strain to our spine. First thing I would have Sarah do is slide her bottom to the back of the seat. Good. So she's making good contact with the back of her seat and our seat. And let's have everybody jump in and join with me. So let's square ourselves up to the seat. You're going to lift your bottom and stick that tailbone, kind of wiggle it back as far as it goes in your chair. Now I actually like the fact that you're using the chairs with the separated back because it gives you room to kind of slide your tailbone back there. Good. Now with Sarah, I'm going to support the small of her back with this nice cushion. So what that cushion does, again, it restores that natural dip to her back, and has her come up a little more erectly with her sitting. Again, the folks in the front who have the chairs with the separation, you're kind of using the upper part of that chair to help support your back, much like this cushion could. But let's say you're in a low, comfortable, soft couch, okay? Sometimes I call this the video game posture. It really kind of sucks your bottom forward and makes your back kind of droop backward into that forward bend rather than the nice arch that we like to have. So this position, long periods of time, might not feel that bad. The recliner chair, a lot of people love that recliner chair. It feels comfortable while you're in it. What's difficult is oftentimes when we return you to the functional position. So you ever have trouble getting up out of the low couch or out of that recliner chair after you've sat in it a while? Go ahead, come on up. So you've assumed this position for so long that now go ahead and stretch, Sarah. Coming up tall into the normal quote-unquote position actually feels a little stiffer and tougher to do. So again, sit for me here. We would prefer you sit with your bottom way to the back, throw an extra couch cushion or a rolled up towel or blanket in the small of your back, and then sit for maybe the same amount of time, and then see if getting up out of that recliner or out of the low, soft, comfortable couch would be any easier for you, okay? We've talked about that. Let's talk about tying shoes. Sometimes getting down to put socks and shoes on in that forward manner really tugs at the low back. Go ahead and show me the wrong way, Sarah. You're gonna sit. Good. Good. And come on up. So we can definitely tell she's reversed the normal curve quite a ways with that movement. What I would prefer, again, sit your hips back in the chair, come up as tall as you can through your chest. If you have the flexibility in your hips, you could bring one leg over top the other and do socks and shoes from this position. Doesn't even involve her back, so we're keeping her in a nice upright position here. Great. When we talk about sitting and the neck, I don't know if any of you enjoy playing on the computer or doing any photoshopping on your computer. Oftentimes that drags our chin out in a forward manner. By the time we get involved after a half an hour or an hour, we look like a turtle with our head forward, okay? This, again, is not that neutral position we promote. So what we would ask is that she practice an activity where she slides her head back over top of her shoulders. Good, and relax from there. So it's almost as if I'm a puppeteer, making her a little bit taller, a little bit longer through the spine. And that, again, helps reinforce not only her neck position, but definitely her back position, too. We can't forget about one or the other, right? We learned earlier they're very interconnected. All right. So stay put for me, Sarah. We're going to talk next about a stable spine. So we've talked about the spine position. We know where we want it. Now we want to keep it strong and stable here. So you have a set of muscles that wrap around you, kind of like I describe a soup can, okay? If you imagine your trunk as a soup can, the top of your trunk is going to be your diaphragm. And I hope we all breathe in and out every day, so I think that muscle's pretty good to go. The lower end of the soup can is our pelvic floor, so those muscles that activate when you stop the flow of urine. And the soup can label that wraps around you tight, you have some abdominal muscles that do that for us. I liken that muscle to an Olympic weightlifter. Do you ever see those big, beefy men and women who are pushing the heavy weight? Oftentimes you'll see them cinch up a belt around their abdomen very tightly so that they can push the weight in a safer manner. We have a set of muscles internally that act in the same manner. So to learn where that muscle is, let's see if everybody can maybe scoot to the edge of their seat. Good, just so your back is away from the chair. Come up tall, so we talked about in that good upright position. I want you to imagine with your low belly button muscle that you gently, just barely pull in that muscle like you're pulling on a tight pair of pants. Okay? Good. What I'm seeing is not a lot of you are changing the shape of your back. So those belly muscles are very much independent on moving or flexing through your back. Once you have that belly muscle on, that's a good thing to think about as you do your movements. So for instance, Sarah, I'm going to have you come up nice and tall. Good. Pull in that belly button muscle. Try to keep it in as you stand up for me. Good. Those of you who want to or have space to, you're welcome to try that too, or practice it later. That's fine with me. And turn the belly muscle on, Sarah, and come on down nice and slow. Good. Keeping your back nice and arched. So if you're having issues with rolling in bed or standing up from a chair, and those activities are difficult or painful for you, this activity is safe and usually helps ease some of that transitional pain that you can get with the low back as you're moving. And when we talk about spinal flexibility, so we've already made the spine a good position. We've already gotten the spine strong, and now we want to get the spine to have flexibility. So if, let's say, so if Sarah's back is peeling away from the chair and she's slumping, or maybe she works in an activity or does some hand stitching that require her to look down long periods of time, this is typically where we find ourselves when we're engrossed in an activity. Rarely do we ever find ourselves in an actual backward bend to do our functional activity. I think it would be nice, but we don't have any arms on the back side of our body. Our arms are on the front. So most of our activities involve forward bending. Now go ahead and come up tall. Good. So oftentimes when we get tired, let's say washing dishes, standing to fold clothes, we have the desire to stretch forward. Go ahead and stand and stretch forward through your back. Good. To try to loosen those tight muscles. It feels tight, so you think that's the direction that we need to go in. But we just discussed, most of the time, the rest of our day is in that direction already. So while it might feel good to loosen the muscles in that direction, our spines get plenty of that direction. And actually, what we would want you to do with fatigue or with tight feeling is to actually bend backward. So you're going to turn sideways. Good. I would have Sarah start with her hands on her hips or her backside if your shoulders have that flexibility. Nice and low so you feel balanced. Another idea for this activity would be to back up to your kitchen counter so that you had pretty steady balance and you could just lean your hips right up against that counter. I would have her very gently, and never to push into pain, take her shoulders gently behind her hips, just to the point of maybe some tension or resistance, and have her come on back up. I will tell you this, the first one won't feel like gold, but if you can do it slowly and gently, and again, don't push aggressively into your pain, the more repeated movements in this direction you do, a lot of times it could loosen up that tension and tight feeling just as well, if not better, than stretching forward. And this is a lot safer and more balanced for your spine. So again, to recap, most of the flexibility we have is in the forward direction with our neck and our back. So if we can do more activities to counterbalance that by doing gentle back bending or gentle pulling back of our head, that will help create a more balanced, healthy spine. Go ahead and sit, Sarah. The similar movement to this for the neck, I really wouldn't want a lot of us folks in the audience doing a lot of extreme backward bending with your neck, but what movement can help align your neck, which is a little safer, if you can watch Sarah, go ahead out to the computer posture, Sarah, with your chin forward. There you go. So I would have her first fix her position, nice and tall, good. And then I would have her glide her head back over her shoulders and release it. And again, glide her head back over her shoulders. I liken this to giving yourself a double chin. None of us want one, but the movement is such that you're giving yourself a double chin. Again, you feel that your chest rises, your posture's a little bit taller, and things are better aligned. Go ahead and relax. Again, do not push into pain with that movement with your neck, but that's a good one for kind of reversing the effects that our computer posture gets us into frequently. Okay. Now we're going to move on to first aid. So new back injury, new neck injury, or gosh, I had trouble and it felt so good for a couple weeks and now it's back. The first 48 hours after a newer injury, we really would like you to use ice versus heat. If you think about it in relationship to an ankle sprain, if it's a brand new ankle sprain and that thing swells up and is puffy and turning blue, I wouldn't want you to put a lot of extra heat on it. I would want you to start with ice. So the same goes for a new back injury. Ice doesn't always feel the best compared to heat, but I think it's definitely safer at this time. Over-the-counter pain relievers, or your ibuprofens or your anti-inflammatory medications, again, go with these easy, and they're over-the-counter drugs, so you can take them as directed. But if you have issues with your stomach or you don't tolerate them very well, it's something I certainly wouldn't push. It is a new injury, so there's the inflammation process that goes on in our bodies, and that's why some of those medications can just speed things up a little bit. We would want you, again, like we talked about, remain active as much as you can within your daily movements to keep the joints moving so they don't stiffen. Low impact walking, again, is a great exercise. One that we probably recommend more than any other exercise out there for back or neck pain, believe it or not. Whether you're in the acute phase, like you just injured it 2 days ago, or whether it's chronic, you've had it for maybe 6 or 7 months. Walking is always based to your tolerance. So again, I wouldn't want you walking into pain, but shorter, more frequent bouts might be needed in the initial phases of your injury. We wouldn't, again, want you to push through it for any activity, and we want you to support that neutral spine. So when a tissue's healing in that new injury phase, we want to put it in the best optimal position to heal, which is the inward curve at the low back and the inward curve up here at the neck. If you want to stand, Sarah. When we go back to that ankle analogy, if we had a new sprained ankle, Sarah oh darn, she sprained her ankle, okay? We would not recommend she walk around like that with her ankle twisted. I don't know if you all can see that, but she's nearly walking on the side of her ankle. Kind of gives you the willies. When we think about it, if we have a new back injury, go ahead and turn away from me and bend forward through the back. Bend forward, yeah. Not quite that far, just like you're stooping a little bit. New back injury, it may want to make you curl forward because it hurts so bad, but her walking or moving in a forward bent position is no different than her walking silly on the side of her ankle with a new ankle injury. Go ahead and stand up tall. So just like with an ankle injury, we would want ice, we'd want her to elevate, we'd want her to keep it in a good alignment to support it. Same goes for her back. Until things calm down, we want her moving, but only in this position, and we want her doing things to take a little bit of stress off that joint. Okay, Sarah, I think I'm good with your help today. Everybody, let's thank Sarah. So again, to prevent and reduce the impact of pain, neutral spine posture. I hope you folks hear it in your sleep because I think I've said it about 20 times today. Recognize how you tend to stress your back. So maybe it's every time you're pulling clothes out of the dryer. Maybe it's only when you're drying the dishes. Try to think about the position that you're in when you're having pain and see if there's anything you can change about your position to improve the neutral spine or the stability or the flexibility of your spine at that time. Interrupt those prolonged positions. So our 2-hour Dancing with the Stars show last night, maybe at 30 minutes in, we could stand, do a couple back bends, walk around the couch, and then back down, okay? And then good strength and function of your spine. So again, get out here and walk at Lindale with the Mercy folks so that you can keep that tissue as healthy as possible. I do want to lastly just mention signs and symptoms that it probably does behoove you to check out with your medical provider. If the pain is newer and it turns into constant severe pain that may radiate from the neck into the arm or from the back into the leg and may be accompanied by weakness. So maybe you'll report to your doctor that my hand became numb or weak gripping objects, or the coffee cup slipped out of my hand and it developed at the same time that your neck seemed to develop pain, that might be something to definitely check in with your physician on. Any new or low back pain, or neck pain following a severe accident, motor vehicle accident, it is important to check out some of those tissues like the bone, make sure there isn't any traumatic injury that needs to be urgently cared for. This is an important one. If you've noticed any bowel or bladder changes with the development of your pain, usually it will be difficulty urinating or fully emptying your bladder, or perhaps a loss or inability to control the bowels. Maybe another reason to seek medical care fairly quickly. In addition, if the pain's gone on a long time or you've tried a few different things to relieve your pain, along with feeling generally unwell and perhaps having some unplanned weight loss, or perhaps your pain is severe at night, those last three there, coupled with pain that won't go away, sometimes can be an indicator of some cancers. So that, again, is something to be worked up for if all those occur together. So I think at this time, I will open us up to questions. Yeah. Let's see. Just so I can kind of move forward and backward. She would like to know if I would recommend walking for degenerative disc disease of the spine. Most definitely. I think, degenerative disc disease, unfortunately, will catch up with all of us at a certain time. At some point, individuals they're showing who've maybe had previous trauma to their spine in their younger years, but almost all of us, it will be evident at some point in our lives. And degenerative disc disease, it can manifest itself in different ways. Your pain might be local, just in your back. It may contribute to pain that radiates out to one side or down into the leg or buttocks. So not knowing your specific situation, I would say walking is a good, safe, low-impact activity that helps keep the tissues as healthy as they can. I would again caution you to walk within your pain tolerance. So if 15 minutes feels great, feels energizing, maybe it's 3 15-minute walks a day rather than 1 hour-long walk that sets you off and makes you a little bit sore the next day. Good question.